So I guess we have to ask the question first, what is quality in healthcare? And there's lots of different definitions for this, but we might say it's increasing the likelihood of achieving the health outcomes that we all want, from the patient's perspective and from the staff perspective, knowing what good care is. Many of you will have heard of the Health Foundation, and they define it in terms of this acronym STEEP, so that care would be safe, timely, effective, efficient, equitable, and person-centered. You'll see many other definitions for it in other places, I'm sure. And those of us who've done some quality improvement will know that we start off a project with this nice plan, like going on this bike ride from A to B, no problems anticipated. We've got a clear target and we think we can get there. But we know that in reality, there's a lot of ups and downs, a bit more like this diagram at the bottom. We get some roadblocks. We realize that there are things that we need to build a bridge to get over, or we need to go a long way round, or maybe we encompass some water that we have to swim across. We feel like we're drowning when we're part way across, or perhaps we go rogue and take the zip wire instead. And we finally get to the other side. So the reality can be quite different from what we expect. But we know in any journey in life that it will be easier if you learn from someone who's already done it. And this is part of the strength of this project, is that we're all working together. We've got different skills and experiences, and we can help each other. And if you were going to go on a boat ride across this lake, it would be really useful to be able to speak to someone who lives near there, maybe has a boat, someone who's been across that lake before. So it's always good to learn from people who've done something similar to what you're doing. And I think we've already found that in the meeting last week when we were talking about face-to-face patient education events. Lots of people have experience. And one of the other things about quality improvement is that we, instead of just doing everything all at once, we test things out on a small scale first, because that's a really low risk approach. We test it on a small scale. We'll see if it works. We analyze what's happened to see if we can make it work better. And if it goes wrong, we're honest about it. We say, well, actually, it didn't work at all, or it partially worked. Why did it not work the way we expected it? The things that work well, it's important that we celebrate those. Those keep us buoyed up and motivated as a team. And it's really important that we do that. And when things don't go according to plan, it's important that we kind of pull together, make a new plan. We don't give up till we get to the end. So a bit of grit involved as well. And we'll see all of this over the next couple of years. So there are 3 central questions in quality improvement. This is based on the very well-known model for improvement methodology. Number 1, what are we trying to accomplish? Number 2, how will we know that a change is an improvement? Number 3, what changes can we make that will result in an improvement? And then once we've started answering those questions, we can design what we might call safe to fail experiments, so testing things on a small scale to learn rapidly what works and what doesn't work. And we might call these plan, do, study, act cycles, or PDSAs. So you'll hear us talk about PDSAs over the next few months. And those of you in the pilot sites will be doing some of those cycles over the next couple of years. So the main concepts are this model for improvement. Secondly, taking time to understand our patients, our staff, and our system before we jump straight to solutions. We always tend to go straight to solutions in healthcare. It's just human nature. We think we know the answer, but sometimes we need to just stop and talk to people who are affected by it first, patients and staff, and maybe other people along the way. You know, why is it that we do it this way and not that way? Have we tried it a different way before? Could we do it a different way? Could we be radical? Just turn something upside down, doing a short experiment, actually just do it really differently on a small scale. Could that work? And be really curious about thinking, how can we do things better? We don't just have to stick to the old ways. And we know that it's 80% about the people, the patients, the carers, the friends, the families, and also the staff. And if we can work with the people, we will find the solutions together. And about 20% of it is about tools, and that is things that we will learn about in the quality improvement methodology, both today and in subsequent sessions. And we've devised 10 simple steps, which is based on the model for improvement, some of which you have already done. And we're going to be focusing on these 5 steps today. First of all, agreeing an area for improvement. So most units have done some work on that and have got some quite well advanced plans for what their area for improvement to work on will be. You've assembled your team. There will be other stakeholders that you might need to work with, and we'll be coming on to that a little bit later. You need to start understanding your problem, your system, your patients and your staff over the next few months, and we'll be hearing from some of our program managers today about some techniques for that. And we need to define the project aim and the scope. So by scope, what I mean is what's in the project and what's not in the project. What are we not focusing on? Because sometimes there can be this kind of what we call scope creep when we start off thinking we're working on this thing, and then other people want you to work on this thing as well, another thing, and before you know it, it can drown you and you can actually lose the focus of what you really set out to do. So it's really important to, from the beginning, think, what are we working on and what are we not working on, and be really not afraid to say, well, it's a really good idea that, but actually we're not working on that yet, but maybe we'll come to that in a subsequent year. And people will understand that because we can't solve everything at the beginning. We've talked a bit already about measures, but what I mean is how we will measure the progress of the project. So we've talked about the national measures, the PREM, the registry, but there will be things that you'll need to collect locally about your project, which aren't currently being collected in any other way. So we do want to collect data, but we don't need to spend all your time collecting data and not enough time working on the project. So that's why we say just enough project measures. So it's important to think about what would be really useful to collect and how easy it is to collect. It might be something you'd ideally like to collect, but it's going to be really difficult, going to take too long, and maybe not possible for the moment. And that may be something you can work towards if it's really important, but may not be possible just yet. And then later on this year, we'll be talking about how we can develop those ideas for change. How can we do things better and differently? How we can test those using these plan, do, study, act cycles. How we can actually get you to actually measure the impact, so not just plan the measures, but actually do it. And that can be more difficult than you think. Analyze that data, and then think, okay, we did the first cycle, this worked, this didn't. Let's think again. Let's do it slightly differently. Do it again. And then to think these things have worked. We're going to implement them in a more what we call sustainable way. So I'm not talking about climate change here. I'm talking about how can we make it happen and keep happening, rather than just because we've all put a massive effort in, but it can't be maintained. So we want to be able to maintain those successful changes over time. And then later on, we want you to be able to share your progress with each other as pilot sites, but also with the wider kidney community. So that might be abstracts at kidney conferences like UK Kidney Week. It may be regional meetings, maybe national meetings.
Sorry, what I would say is
somebody just needs to go on mute there. That's it. So I'm just going to talk a little bit about leadership now, because quality improvement, it's really fun, it's really rewarding, but it can be quite challenging as well. And you'll see at the top, this is quite familiar from politicians we've heard of in the last year or so. Who wants change? Everyone puts their hand up, don't they? Who wants to actually change? Not so many hands. And then who wants to lead the change? Suddenly things can go very quiet. Sometimes nobody wants to be responsible for actually leading the change. But we're really grateful to you as pilot sites and patients who've come together today, because you have actually stuck your hand up. You want to be part of leading that change, making that change. So without you, we wouldn't be getting anywhere. But it can be challenging. So what is leadership? So it's certainly challenging the process and creating a vision and inspiring that, enabling other people to act out that vision, and you've got to role model it yourself. If we want to do things this way, you've got to start doing them and showing that you're doing them. We need to create an environment that supports your team members in fulfilling their role. And we want to gradually make our followers in the team into leaders, so developing their leadership skills. And that could be done in all sorts of different ways. And leadership is certainly something for the many people, not just for the top people who are controlling all of things. We want leadership to be sort of from the bottom upwards, and which is why we want our patients, carers, and other people living with kidney disease to be part of this journey, part of this project. We also need to think about human factors, because we know that when we're changing things, this can feel quite threatening and difficult. So we all have physical, social, psychological, and neurological or brain needs. So when we change things, people can think, what does this mean for me? What will other people think of me being part of this? Am I actually good enough? What will happen if I fail in this project? What if I fail to be successful? If I make these changes, will I lose control over my circumstances, my job, my working day? Will it affect my family, my social life? Lots of potential fears there. And also sometimes we just have fears. I don't know what to expect. I need more time to think. We've got this kind of block in our mind. We've always done it this way. I don't want to change. I don't know what to expect. It feels really uncertain. And those are all really natural. And we've probably got those things going on right now inside our heads, but we also have to realize that the people that we work with, the people that we need to engage with, are going to have those thoughts as well. So it's really important that we have what we call psychological safety within our team and with the wider people that we need to work with. So this has been pioneered and spoken a lot about by Professor Amy Edmondson from Harvard Business School. Psychological safety is a belief that we'll not be punished or humiliated if we want to speak up with ideas or concerns, or even if we make mistakes, and that within our team, it's safe to put our hand up, to come up with ideas, to say that didn't work, or to say, I think I've made a mistake. It feels like taking a risk, but we've got to make sure it's safe within our individual teams and within this wider team, the Transform AKC team, because it's only that way that we can move forward. We all will have been in situations when we felt psychological danger. We feared admitting mistakes. We felt we were being blamed. We feel less likely to share things. And it can affect the way the team performs. Sometimes people stop engaging. Sometimes meetings can feel quite difficult and threatening. We don't want any of that. And we certainly don't want that within your individual team meetings in your places of work. So psychological safety would mean that we feel comfortable admitting mistakes. We can learn from failure. We can openly share ideas with each other. We won't be criticized. And that allows us to be more innovative and to make decisions going forward and hopefully grow our skills as a team. It can be difficult to encourage people to adopt change. We know that this is just the natural spread of where we are with personality types in the population. Some people are naturally innovators, you know, the Elon Musks of this world. Some people are naturally at this other end, what we might call laggards, people who need a lot of convincing and maybe never really want to change. And many of us are in this kind of middle group here, what we call the early majority, late majority. Some of us are early adopters. We're quite keen to get that new gadget. So in encouraging people to adopt change in our projects, we need to have what we might call our lift speech or elevator pitch. Why is it important? What are we going to do? And how are we going to do it? And how do we need somebody's help? So a lift speech is what you can say when you're going a few floors up in the lift, perhaps with that key person that you'd really like to engage with. It's got to be short and snappy, maybe no more than a couple of minutes. So working on that, practicing that as a team. Why is it important? What are you going to do? How are you going to do it? Is really can be quite powerful. Patient stories, human stories, we know are really powerful in encouraging people to change. So good to have some of those that you know of from within your team, within your workplace, affecting your patients. Yeah, Shahid, Elon Musk, not a particularly good example for anything. I think many of us might feel that right now. And it's important that we can communicate our successes to our key stakeholders, be they patients, carers, staff members, chief executive. We need to be able to work on that. And final slide, You will meet resistance at times. I probably won't have time to go through all of these things, but we can send you these slides. Lots of different ways to help change people's mindsets, help to deal with that resistance. Resistance is normal, it's expected, but we can be skillful in how we try and navigate that. That's just a summary of the main concepts. Thank you so much.